Welcome to the show, where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we welcome back Erica Moseson. She is a pulmonary and critical care physician, and she wrote the Kevin MD article, Clearing the Air Our Kids Share, a prescription for healthy schools. Erica, welcome back to the show.
Thank you very much. It's great to be here.
So we'll get into your article in a little bit, but first off, for those who didn't get a chance to listen to our first few episodes, can you just briefly share your story and journey to where you are today?
Yeah, well, I'm a lung and ICU doctor, and a lot of times when I'm taking care of patients, I'm working really downstream, from kind of a lifetime of either smoking cigarettes or being exposed to occupational hazards or severe asthma caused by air pollution. And increasingly out where I live on the West Coast, the health toll of wildfire smoke. And so I started a podcast and a website called Air Health, Our Health, really trying to focus upstream on the drivers of a lot of those, things in the air we breathe and underlying forces like climate change, tobacco industry hijinks, even, forest management and wildfire resources. So, and it's been a very, I think, creative and helpful outlet as a physician who we're all kind of trying to battle burnout right now. And so, I really think trying to focus upstream on what's landing everyone in the ICU, especially in the times of COVID, has been good for my mental health as well.
So by the time this episode comes out, we're going to be in the midst of the Omicron variant. For those who are on the fence when it comes to getting vaccinated, can you paint us a picture of what you're seeing in the ICU today?
Well, honestly, it's increasingly a disease of the unvaccinated, and it's really heartbreaking. One of the most important things I need to know about someone who ends up in the ICU is honestly whether or not they're vaccinated, because it tells me so much about their prognosis. And it's been awful. I mean, I've had husbands and wives dying together in my ICU. I've had, been talking to their children. We get to know people over the course of several weeks because these are prolonged, horrible ICU stays with, intubation, proning, blood clots, multiple complications, perforated lungs, chest tubes, and their families go on this roller coaster with us. And frequently people don't make it, especially if they're intubated, especially with the Delta variant, and who knows what the Omicron variant is going to bring. It's a disease right now of the unvaccinated when you're getting to my level, when you're getting to the ICU. And so just the most important thing people can do is get vaccinated and get boosted. I mean, so for Omicron, just having the first 2 doses is somewhat protective, it looks like. But that third dose is actually really immunologically interesting. It's more than a booster. It actually seems that kind of having that third dose after a time frame helps just kind of create a much more mature immune system with a much more robust response against Omicron. So all I can do is just encourage everyone to get vaccinated. It's kind of the most important thing you can do to avoid seeing me. And no one wants to see the ICU doctor.
For those who do recover from COVID, do you see any regret from patients?
Yes, I would say the vast majority of people, as they're coming into the ICU, are kind of sheepish a lot of the time and saying, yeah, I kind of wish I'd gotten vaccinated, or I was just waiting, or, very few people, although there have been some, have been, I've had people screaming at me that I'm lying to them, that they have COVID. But for the most part, most people, it's really sad when they ask, can I get the vaccine now, when they're already coming to the ICU with COVID where it's way too late. But most people, recognize, gosh, this really is serious. And, maybe they've been misled on Facebook, or there's all sorts of people kind of trying to hustle and sell whatever product they have, and kind of make money on sowing vaccine misinformation. But most people, I would say, who come in kind of wish they'd gotten vaccinated. And, not everybody, but a lot of people even recovering, talk about, okay, so when can I get my vaccine? I don't want to go through this again.
All right. So let's transition to the Kevin MD article that you recently wrote. It's about our air in schools, which is a very, very relevant topic that I'm certainly hearing about in my own daughter's schools. So it's titled Clearing the Air Our Kids Share, a Prescription for Healthy Schools. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, absolutely. So I think, going over the summer, I have, 3 young kids at the time. They were unvaccinated. And so, we're just trying to think of all the things that could help prevent transmission in schools. And for most of the summer, I was, advocating fairly strongly that we maintain a mask mandate. And then really kind of focusing on, okay, well, once the kids are sharing air and they're wearing masks, when we were starting to see the explosive rise of Delta, and realizing that despite that, there may still be significant transmission risk, what else can be done? And so, Johns Hopkins and the CDC and multiple organizations had really looked at, what does the evidence show, and had kind of put together guidelines for what can be done. So what you really want to be doing is diluting the virus from the air. And the best way to do that is both with ensuring there's good ventilation, whether in your HVAC system, if you've got a centralized HVAC system, kind of cranking that fan up, you really are trying to shoot for 6 air changes an hour. And then in places that don't have a central system, making sure there's windows open with a really good cross breeze, and also adding Hepa filtration into the classroom, where you are actually pulling virus out of the air, particulate matter out of the air, and kind of trying to circulate that and capture it on a fibrous filter. There's also a lot of concern about the flood of funding that kind of went out to schools to help them with COVID, and the ways it may have been potentially misdirected at technology that we're not quite certain of yet. So there's a lot of, I'm sure, very well-meaning companies out there advocating for, putting chemicals into the air to try to clear it or kill the virus. So everything from, nebulizing or, putting hydrogen peroxide out into the air the kids are breathing. There was a lot of talk of foggers. There's a lot of talk of ionizing technology with, claims that, these ions are going to make the viral particles glom together and they'll fall to the ground. And really, the more I've, explored that with experts, we really don't have the data to support these additive technologies in terms of health benefits. So it's kind of one of those things where maybe they work, but if they do, it's probably not healthy for your kids to be breathing them, because the field of pulmonary medicine is littered with stuff that, we thought was safe to breathe and turns out to cause disease. So it's either they do work, but you probably don't want your kids breathing it, or maybe they don't work. And there's some studies of some of these commercially available, induct ionizer systems or hydrogen peroxide systems that suggest that when you're actually looking at building scales and the complexity of the built environment, they really may not be doing anything, in which case you're only accepting the risk of the harm and not really the benefit. So, it's something that I didn't think about a lot in med school is, HVAC systems and air filter technology and the way our buildings are built, but it is actually something that's very important to human health.
So when it comes to HEPA filters, I've seen so many different types being sold to our schools. Any specific type? Is this something that you just buy on Amazon? Like what do schools have to look out for when they're purchasing or considering a HEPA filter?
So honestly, HEPA filters are, the things to look for is to make sure it's a true HEPA filter, right? So the hard part is this is completely unregulated. The only thing, California has attempted to kind of at least show whether or not something's emitting ozone, because ozone is completely toxic to human health. And some of these older technologies, and ionizers would actually emit ozone that can really be toxic. So there's really not that much regulation. So what you want to be looking for are, HEPA filters are certified that, they have to go through a testing process to show that they reduce, particulates below to 0.3 microns in a very efficient way. So I would be looking for things that say HEPA filters. And then the most important thing is you want to look for the CADR, which is the clean air delivery rate, which basically is kind of the size of the air that filter can handle. And it'll tell you how many air changes you can expect for a room that size. So really, just buying a little teensy tiny one that can only, that's designed for 100 square foot room and expecting it to really clear the air of a, 600 square foot classroom or to be put in a gym doesn't really work. They're not magic. So, but they are additive, right? So, if, you get, 2 in a row, you could kind of add their CADRs together to kind of try to clear that space. So really just, looking for something that's taking something out of the air, that's pulling the particles out, and then making sure it's appropriate for the size of that room is the way to go. But I don't endorse any specific devices, nor does, any of the other, the CDC or the Johns Hopkins, Center for Biosecurity, who really, authored one of the more expert reports on this topic. But, there's a lot of different manufacturers, but as long as you're looking for a HEPA filter that's really pulling things out of the air and not adding things into it, I think schools are in.
So correct me if I'm wrong. So from what I'm hearing, if schools were to spend money to quote unquote upgrade their air filtration system, they should be looking to upgrade their HVAC system and purchasing true HEPA filters. Are those the only 2 things that you feel is recommended?
Well, so there's a couple of things. So if you've got, so more modern buildings that have a full centralized HVAC system, if they can work, like if they should contract with their HVAC professional to check to get to a MERV 13 filter or higher, that's basically putting in, that HEPA level filtration for a whole building. And then if they can work to try to be getting that 6 air changes, an hour through their centralized system, that's great. And you probably don't need portable HEPA filters in addition. If they can't, then it may make sense to add in a HEPA filter or two if you can't quite get there with your central HVAC system. And that just is more of a kind of a power issue and, how much strain can the system handle question. And that's, beyond my scope. That's more for the engineers. And then the other thing is, ultraviolet germicidal radiation does work, but it's very expensive and those bulbs have to be changed, every 6 months. And those are pretty sophisticated ways of, kind of killing virus and everything, but those can be very prohibitively expensive. And that's something that you kind of have to put up into the central system and make sure that no one can see it, right? Because obviously if it's UV lights that you're seeing, that's not good for you. And then people will market all sorts of things like little UV wands that you wave around, and you don't want to kind of get derailed into very expensive UV technology, potentially if you've got a fixed budget, so I think it definitely works and it's recommended. And a lot of, places will use that to kind of clear the air of infectious agents, but it can just be a lot more cost prohibitive depending on the school's budget.
So from your experience, how many schools do you estimate have satisfactory air filtration systems based on what you've told me?
I honestly don't know. It's been so interesting, and it's been interesting to have parents reach out to me, right? So, put an episode out about the air kids share with an expert from the Center for Biosecurity, Paul Olszewski. And then I had people reaching out saying, hey, just kind of sending me the email sketches of what their school had installed in the district. And it was wild. I mean, there is a lot of this, ionizing technology out there, and it looks good. You go to their websites, it looks pretty, spiffy. They give you these chamber studies where they show these, viral particles falling. And granted, it's not usually tested on the actual virus. It's generally tested on a phage or a similar type of virus. And they're usually kind of small chamber studies, really not studied, at the building scale level. And so it's interesting. I mean, some schools have actually engaged in lawsuits after some studies came out showing that these may not work at the whole system level. Some schools are actually kind of going after these companies who are in turn turning around and suing the researchers. So it's getting a little, conflicting. And I'm sure it's just kind of, a lot of people were very well-meaning and said, oh, well, hydrogen peroxide kills virus. Let's just kind of throw it into the air without kind of thinking from the medical side. Well, would you say, hey, I've just pumped a bunch of hydrogen peroxide into this air, send your child in there to breathe it? Like I wouldn't, granted I'm a lung doctor, but I think a lot of people wouldn't want to do that either. So again, it goes back to, either that other technology does what it says it does, in which case it's probably not healthy for our kids to breathe it, or it doesn't really do that much, in which case it was kind of a waste of money and we could have spent it better on HEPA filters.
Can you give us an idea of the scale of the costs if a school were to upgrade their filtration system? Are we talking about thousands of dollars? Are we talking about tens of thousands, hundreds of thousands? So just give us an idea about the potential costs and whether this is prohibitive for many schools.
Yeah, well, the nice thing is there was a lot of funding with the CARES Act for COVID upgrades for specifically air cleaning technology, which I think is kind of why there was a flooding of the market with some of these things that may not work, because where there is funding, people will find it, and I think it depends. So I'm sure upgrading an entire HVAC system is very expensive, and it probably depends on the type of school and where you're at. But I do think there are things that can kind of fit each budget, so you can get a 400 square foot HEPA filter, cleaning that's pretty good. I have one for my house that's in the $200 range, right? And so granted, you scale that across a bunch of classrooms, but even just simple things like thinking of the ventilation, the dilution element of it, where you open the window, introduce a cross breeze, and then have some more HEPA filters, and that would be kind of at the lower cost. And there's other options where you strap a MERV 13 to a box fan, and that's $50, which a lot of got scaled up in the wildfires, which kind of works honestly in a similar way. So I think compared to the scale of a lot of the other expenditures schools make, I hope that this would be a reasonable investment. And more importantly, the CDC's done some modeling that shows with masking and a couple of HEPA filters, you can drop the potential, viral load in a room by something like 90%. So it's pretty effective. And when you think of the cost of each extra spread of COVID and people spending time in the ICU, I would hope that communities at the state level, county level, and the federal level view this as an investment that's worth it.
Can you give us a sense of the data? So you did mention that things like HEPA filters and masking can decrease viral load, but in terms of real world scenarios, is there any data suggesting a decreased relative risk reduction if we properly install HEPA filters in a school?
Well, so I think it depends. I honestly hope that people study this going forward this year, because I actually think we have a bunch of observational cohort studies ongoing across a bunch of different schools in America. The data for HEPA filters with, for example, so looking at particulate matter. So a lot of the times with COVID, and there's been this concern about COVID traveling with particulate matter, or kind of areas with, kind of these smaller kind of particles being a problem for COVID. So when they've looked at things like HEPA filters in kind of wildfire scenarios where they do these pretty good sham trials where they'll have one in the corner of a house that's running and one that's not running, and you can actually see the decrease in the particles of concern in the ones where it's actually running, and then also decreased, respiratory events and everything for, especially for vulnerable populations. I think for COVID specifically, I'm not aware of studies that have come out yet, especially for schools, since a lot of people were out of school, but I'm hoping that will be studied, and because I think this is something we need going forward, because a lot of times doing things to decrease particulate matter is going to be important, not just during COVID, but obviously during wildfire season, or for urban schools heavily affected by air pollution, or for rural schools heavily affected by wildfires. So it's kind of a, investing in clean air in COVID times, especially if you're doing subtractive technology like HEPA technology to reduce particulate matter, is going to also pay off during wildfires and air pollution and all the allergies, pollen. I mean, we have increasing, pollen burden as the climate warms. So I think it's kind of one of the things that if you invest in the right technology now, I think it pays off in the long term.
We're talking to Erica Moseson. She is a pulmonary and critical care physician, and she wrote the Kevin MD article, Clearing the Air, Our Kids Share a Prescription for Healthy Schools. Erica, if I'm a school administrator, I think I've heard some of the messages that you said, but what are some of the top take-home messages that you want to give to school administrators out there when it comes to clearing the air into schools?
Well, I like a phrase that I've heard called the 4 Ds. So thinking about density, right? So decreasing the number of people in a space, thinking about distance, keeping the space between them, thinking about, kind of the dilution of the air, right? So both not having the mask, putting things out, and then also using the HEPA filters and open windows and everything to kind of clear the air. And then duration, right? So trying to not have people together for too long, or trying to get them outside if they're going to need to be together for a while. So I kind of think those 4 Ds are helpful. And then investing in technology that is, recommended by public health experts. The Johns Hopkins Bloomberg School of Public Health has put together an excellent document specifically for administrators that I like, that is actually has like, punchline, take home, simple messages, and it's not too technical. And so I think looking to those kind of resources, and not necessarily trusting the super friendly and well-meaning salesperson who wanders by promising, magical ions that will pull COVID from the air.
Erica, thank you once again for coming on the show and sharing your time and insight.
All right. Thank you very much.